is a serious, costly chronic disease. Over the years, it's become more common, particularly among children, with experts warning how it poses a threat to global health. A 2022 study in the Lancet Medical Journal showed that more than 1 billion people to be obese. That's more than double the number it was in 1990 among adults and 4 times more among children. The World Obesity Atlas predicts more than 4 billion people will be obese by 2035. In the United States, the Centers for Disease Control says the number of obese adults has nearly tripled in 50 years. Studies show obesity is negatively associated with a person's productivity, resulting in less contribution to the economy. In fact, the World Obesity Atlas says that by 2035, the global economic impact of obesity will reach $4.32 trillion a year. The CDC says obesity-related healthcare costs the US an estimated $173 billion a year, while the EU says member states spend almost 7% of their budgets treating health conditions related to obesity. That's about $71 billion. Lower-income countries have also witnessed a surge in costs. Scientists are creating solutions to this growing problem. In the US, researchers at the University of Colorado have created a vaccine that makes the body immune to gaining fat. It's different from Ozempic, which prevents a person from overeating. The UK National Health Service also authorised the use of Wegovy to manage obesity alongside diet and physical activity. For more on this, we're joined by Dr. Bharat Pankania, who's a senior clinical lecturer at the University of Exeter. Good to have you on the programme with us, Doctor. Now, what's been driving the global surge in obesity, particularly among children?
So this is very multifactorial. It is no one item. So the multifactorial items are diet, sedentary lifestyle, economics, and of course cultural, marketing, and of course access to healthy foods. And these days, when we've got a lot of IT technology, our children sit on their smartphones, and of course with that smartphone and sleep deprivation, all of those items contribute eventually to putting on a few grams and a few more grams and a few more grams, and before you know it, you are obese.
Now, obesity-related issues are projected to have an economic impact of more than $4 trillion over the next decade. How does it weigh down the economy, and what are governments doing to address this?
So it weighs down the economy because on a personal level, the obese person is going to have more healthcare issues, diabetes, heart disease, arthritis. And then secondly, they are obviously taking time off work and therefore their productivity is low. And with that, it costs the nation also a lot of money to try and help them. So once you've got your type 2 diabetes, you've got your high blood pressure, your arthritis, it's very difficult to reverse it. And therefore, I, as a public health doctor, always advise governments, what are you going to do? Well, what you should do is prevention, because prevention is the best and the cheapest strategy possible. So what do you do? What do I mean by prevention? It's the first 10 years of life that work the best. In other words, portion control, healthy eating, exercise, and good sleep. Now, with respect to healthy eating, you have to also fight big interests. There are mega interests with a lot of power with their ultra-processed foods that they want us to consume instead of the healthy food which we would like people to consume. So governments should also invest in subsidizing healthier foods, because after all, in a roundabout way, we are subsidizing the highly processed food manufacturers in any case through extra healthcare costs to us.
And we are hearing of new medical advancements like vaccines and drugs recently. What role do these play in combating obesity?
They have a role. Without a doubt, they have a role. But I must refer back to the better strategy, which is you set the prevention controls in place, and therefore you stop your population from becoming obese and needing these drugs. Having said that, some of these drugs are a breakthrough, and they will work used properly because they are basically resetting your brain's demands that you want food. But better than that, prevention is a better strategy. But if you need to use those drugs, they are going to work in that population for which it is meant to be.
Okay, Dr. Bharat Pankania from the University of Exeter, thank you very much for your insights.
You're welcome.